Welcome to the Clinical Parasitology Unit 3 first video. Laboratory techniques. Let's start. 1. Procedure for clinical specimen collection for parasitic investigations. A. Stool sample. Collection container, clean, dry, wide-mouthed container with a tight-fitting lid. Instructions: avoid contamination with urine or water. Time: ideally examined within 30 minutes of passage. Preservation: 10% formalin or PVA, polyvinyl alcohol, if immediate examination is not possible. B. Urine sample. Timing: collect between 10 am 2 pm or post-exercise for Schistosoma hematobium. Method: midstream or terminal sample in a clean, dry container. Preservation: formalin may be used if delayed examination. C. Blood sample. Collection sites: finger prick or venipuncture. Type: capillary for thick smear, venous for thin smear or concentration techniques. Timing: according to parasite periodicity, e.g., Plasmodium species fever peaks. D. Sputum sample. Purpose: for detection of Paragonimus westermanni, lung fluke. Instructions: early morning deep cough specimen in sterile container. E. Exudates, swabs, and aspirates. Types: vaginal, urethral, nasal, throat, rectal swabs. Tools: sterile swabs or syringe for aspirates, e.g., abscesses, CSF. Transport: use appropriate media and avoid delays. 2. Preparation of reagents for routine diagnostic purposes. Reagent preparation and use. Iodine solution: dilute Lugol's iodine, 0.5% 1%, for staining protozoan cysts. Brine solution: saturated salt solution used in flotation technique. 33% zinc sulfate solution: dissolve ZnSO in water used in flotation concentration. Normal saline, 0.85%. Dissolve 8.5 grams NaCl in 1L distilled water for wet mount preparation. Stools reagent used for detecting occult blood in stool, contains guaiac, hydrogen peroxide. Giemsa stain: 3% Giemsa in buffer for staining blood parasites, e.g., Plasmodium species. Leishman's stain: methyl alcohol and Leishman's powder for differential staining of blood smears. Benzidine solution for detection of occult blood, use is restricted due to carcinogenicity. 3. Various laboratory techniques. A. Fecal, stool, examination. Physical: color, consistency, presence of blood/mucus/worms. Chemical: reducing substances, test with Benedict's reagent, especially in infants. Occult blood, benzidine or guaiac-based tests. Microscopic: saline wet mount, detect motile trophozoites, ova, cysts. Iodine wet mount, visualize cysts with internal structures. Concentration techniques: flotation/sedimentation. B. Blood examination. Wet smear, for motile microfilariae. Thick smear, increased sensitivity for parasite detection. Thin smear, for species identification. Staining: Giemsa or Leishman's stain. C. Urine and sputum examination. Urine. Centrifuge and examine sediment for Schistosoma hematobium eggs. Sputum. Wet mount and stain for Paragonimus eggs or larvae. D. Concentration methods. Flotation, uses high-density solutions, zinc sulfate or brine. Lighter ova/cysts float and can be collected from the surface. Sedimentation, heavier ova/cysts settle at the bottom. Formalin ether method is commonly used. MCQs. 1. Which preservative is commonly used for stool specimens when immediate examination is not possible? A. Lugol's iodine. B. 10% formalin. C. Zinc sulfate. D. Glycerol. Answer: B. 2. Which reagent is used to detect occult blood in stool? A. Iodine solution. B. Giemsa stain. C. benzidine solution. D. Normal saline. Answer, C. 3. The best time to collect urine for schistosoma hematobium is A. Early morning. B. Late evening. C. 10 a.m. to 2 p.m. D. Any time during the day. Answer, C. 4. Which staining technique is best for identifying blood parasites like Plasmodium? A. Gram stain. B. Ziehl-Neelsen stain. C. Giemsa stain. D. Methylene blue. Answer, C. 5. Which technique concentrates lighter parasitic ova using high-density solutions? A. Sedimentation. B. Flotation. C. Centrifugation. D. Decantation. Answer, B. 6. Which solution is used in flotation technique for parasite concentration? A. Formalin. B. Normal saline. C. Zinc sulfate. D. Acetone. Answer, C. 7. A saline wet mount is typically used to observe A. Bacterial spores. B. Ova and trophozoites. C. Fungi. D. Red blood cells. Answer, B. 8. Leishman stain is primarily used for A. Stool parasites. B. Urinary parasites. C. Blood parasites. D. Respiratory parasites. Answer, C. 9. Which solution is used to highlight cyst structures in stool examination? A. Brine. B. Iodine solution. C. Giemsa. D. Acetic acid. Answer, B. 10. Stool should ideally be examined within how long after passage? A. 2 hours. B. 30 minutes. C. 4 hours. D. 1 day. Answer, B. 11. Which stain is preferred for thick and thin blood smears? A. Gram. B. Leishman. C. Giemsa. D. India ink. Answer, C. 12. What is the concentration of normal saline used in wet mounts? A. 1%. B. 0.85%. C. 5%. D. 10%. Answer, B. 13. Which specimen is used for diagnosing Paragonimus westermanni infection? A. Urine. B. Stool. C. Blood. D. Sputum. Answer, D. 14. Which flotation solution is saturated with salt? A. Zinc sulfate. B. Brine. C. Formalin. D. Acetone. Answer, B. 15. Which method is commonly used for sedimentation concentration? A. Brine flotation. B. Formalin ether method. C. Saturated sugar. D. Behrman technique. Answer, B. 16. Which is a reducing substance test for stool? A. Benzidine. B. Benedict's solution. C. Giemsa stain. D. Lugal's iodine. Answer, B. 17. Wet mount preparation for stool uses. A. Giemsa stain. B. Gram stain. C. Normal saline. D. Acetone. Answer, C. 18. Why is immediate examination of stool samples important? A. Avoid color change. B. Prevent parasite death. C. Prevent dehydration. D. Maintain pH. Answer, B. 19. Which of the following is carcinogenic and used for occult blood test? A. Giemsa. B. Leishman. C. Benzidine. D. Formalin. Answer, C. If you guys are watching till now, then please don't forget to subscribe the channel and make sure to like, share and comment. Thank you. 20 cysts in ova in stool are better visualized with A. Acid-fast stain. B. Normal saline. C. Iodine solution. D. Blood agar. Answer, C.